First and foremost, thank you for your comment. I really appreciate the kind words. And I know we don't always see eye to eye, but I think those are the most productive conversations because you can actually, have a back and forth and learn about other viewpoints and you just grow from it. And you bring up a very good point here that I think needs to be acknowledged. I certainly have a bias towards doctors, a positive bias. I look at doctors very favorably, but that's probably not a surprise. I am a doctor, but it's a little more complex than that. So the reason I have such a positive view of doctors, maybe overly positive, is, having worked in medicine over the years, I got to meet a lot of good ones. I had amazing mentors, friends, colleagues who were genuinely good, caring clinicians that took their time, that did their best for patients, and that's painted a very positive view of doctors for me. That being said, you make a very fair point. That's more of a positive bias, not reality. And when I step back and think about it, I actually remember there were plenty of bad doctors too. I remember the good ones because your mind does that, but there were certainly bad ones. Reflecting back now, I remember doctors cursing and shouting at trainees, being abusive towards them. I remember doctors gaslighting patients. One was so bad, I think they called him a butcher. He was like a surgeon that did like zigzag cuts that had worse like infection rates, I believe, and had some kind of weird like, I don't know, sexual assault thing. I don't know. They made the news. It was that bad. Like, it's crazy. And I've seen doctors that have like time sensitive, labs come back on a patient that immediately needs treatment and they just wait months to follow up on it because the patient's appointment isn't for months. And just so many examples where things get overlooked, things get missed, diagnoses are missed, trainees are mistreated, patients are mistreated. And certainly I don't want to absolve these doctors or just say, oh, their doctors are fine. No, they're not. And part of my channel here is to discuss problems in the healthcare system, which includes insurance companies, there might be some toxic patients, whoever else, but certainly we should call it doctors too if they're problematic, and certainly they are out there, unfortunately. But my inherently positive bias just comes from the fact that I've also known a lot of good ones and they've painted a more positive picture, but certainly we need to acknowledge that the bad ones are out there. There's plenty of them, and they should be called out just as much as any other problem in the healthcare system.